Hello, everyone, and welcome to Biological Psychology for Winter Intersession 2025. My name is Dr. Michael Nadorff. If you haven't met me, I'm a professor of psychology. This is Lovey Cat, who made an appearance in last year's video, and he was already sitting on me, so I thought I'd let him persist and actually see the presentation. So I always like to do a video to kind of introduce you to the class like I normally do on the first day, hopefully answer some of the main questions that you have, and just go through the syllabus and make sure you have what you need. So with that, my goal is to briefly introduce you to me and to Levy, um, introduce you to why biological psychology is important, review the syllabus and kind of go over the class, and then again, just give you the main tools you're going to need as far as completing the class. So I always kind of like to know where my professors came from and their background. So I always like to give that for myself. So I got my bachelor's at the University of Notre Dame and I studied psychology and computer applications. And biology, I started taking pretty early. So I actually started out pre-med, but I decided to switch to psychology in my sophomore year. I found that my passions were more in line with psychology. And then at Notre Dame, actually, the equivalent of this class was called physiological psychology. And it was not a required course, but it was an elective that I took, mostly because people told me it was really helpful for getting into grad school, which it was helpful for that. But as I went on, I realized just how important it is for psychologists to know this information, as we'll talk about in the coming slides. So I did my bachelor's there, and then I did my master's and PhD at West Virginia University in clinical psychology. So there, I did the required coursework in biological psychology. But again, I actually took a second elective. I took a psychopharmacology elective. So that's how all the medications that have an effect on your brain, how they work. So I got a little extra training on biological aspects and psychopharmacology. And then I also had clinical experiences that were related to biology. So I worked for 2 years in an insomnia clinic. I also worked for a year in a psychiatric nursing home and also on the WVU bone marrow transplant unit, which is part of the cancer center. So I worked in these settings that were very biological, and what it helped me appreciate is just how much you need to know as a psychologist about biology in order to be competent and to do the work that we do properly. So I really think to be a competent psychologist, you have to understand biology. If you don't understand this class, you're not going to understand how the medications work. You're not going to understand when a medication is or it's not needed. You're not going to be able to rule out some of the things that commonly can look like psychological problems, such as um, low testosterone can look like depression. Also, if you have a UTI in older adults, it can actually look like dementia. So, knowing the biological is really important for being able to do the psychological work. I did my internship, which is our version of a residency, since I'm a licensed provider at Baylor College of Medicine. And specifically, I was on the geriatric mental health care and research track. And it was split where I did half my time at Baylor College of Medicine, and I did half my time at the Michael E. DeBakey VA Medical Center in Houston. So with that, I actually spent 6 months during neuropsychology, so doing a lot of psychological testing. And then we had a 6-week didactic series on psychopharmacology, which was taught by the psychiatrists there for the psychiatry residents. So it's really cool because I got to go to the same lectures and talks that the psychiatry residents were going to and get a lot of that same information. So a lot of that I bring into my class as well. So since it's an intersession, the best way to get in touch with me is by email, which you have there. You're also happy to meet with me in Rice. I am traveling some over the break. I'm out of town the 26th through the 4th, but I'll be accessible the whole time via email, and I can do virtual meetings. So don't hesitate to get in touch. I'm just saying that I won't be actually in Rice Hall during that time. But feel free to get in touch with me and I'll follow up with you. It's not a problem at all. So, why is biosec important? So, as I alluded to, mental and his physical health really cannot be separated. And I always think back to an experience I had on the cancer unit where one of my clients was very depressed. And so, after gaining medical clearance from the physicians, I started doing behavioral activation, which is one of the main treatments that we do when people are lacking motivation, lacking enjoyment in things. And lo and behold, he wasn't able to really engage in it, able to do it. And we found out later that he had a big tumor right on the part of the brain that's important for motivation. So, you know, if you don't understand biology, you're going to run into issues where it's not a psychological problem. So, it's important for understanding the difference. Also, about half of us applied psychologists, so clinical counseling, school folks, we half of us worked in medical environments. The VA hospital system, where they serve veterans, is actually the largest employer of psychologists in the U.S. And more commonly, you're seeing us being hired in primary care, weight loss clinics, sleep medicine, cancer units, a lot of medical. So having the background is really important to be able to plug into these systems and just come on seamlessly. So it's difficult, if not impossible, I think, to be a competent psychologist without a strong understanding of biological psychology. And we know that many of the jobs are at med centers, and having this background is really going to be essential for that. So, as far as the course, it's okay to be nervous. This is one of the more challenging courses in the curriculum at MSU. With that, I really try to set it up so you have a high, likelihood of succeeding. I have high expectations, but I'm giving you a lot of resources, to hopefully be able to do what you need to do. The best advice I have for you is read the book in addition to watching the videos. I know it's easy enough to just listen to the video while you're making dinner and ignore the book and just take the quiz, but you'll be much better off if you watch or if you read the book too. Just because I can't cover everything in the book in a recording. I literally would be me reading the book to you. So there's just not enough time to be able to do it. So it's important to do both because the quiz material can pull either from the readings or from the videos. Speaking of the book, here's a copy of it. So it's Breedlove's 10th edition of Behavioral Neuroscience. If you have any trouble getting hold of it, let me know. A couple of years ago, we had some struggles, but it was better last year, so I'm hoping that'll persist. There are overall 4 exams and one final exam. Each exam is worth 100 points. With that, though, I drop your lowest exam grade. So ultimately, the class is graded out of 400 points. So if you take the first 4 tests and you are happy with it, you don't have to do the final, or unless you want to. But also know that, and actually, as the person that taught my class list that I always had this saying, it's very possible that the first one's an ugly waffle. Like sometimes it takes a while to learn what the tests are going to be like, what the instructor expects. So that's okay. If you struggle on one of the tests, that's why there's a drop. So don't fret that. That's why it's graded out of 400. The lecture slides are on Canvas, and also all the links to the videos are on Canvas. If there's something that you just aren't getting, or I haven't answered clearly, or just feel free to email me and let me know. It's your responsibility to ask me about it. So you can't take the test and be like, you didn't explain that well. If you have questions, ask me before you take the test. But I'm happy to answer questions. I don't actually get to teach undergrads that much. Um, just with the stuff I teach, I usually am teaching just graduate students. So I really enjoy getting to actually teach undergrads. So with that, yeah, I truly do welcome the interaction. I know it's a little different with it being a virtual class, but truly don't hesitate to reach out. I enjoy talking with you and would rather have you, talk some. It's, get to know you a little bit. So happy to meet or email. Here's my email address. And let me run you through the syllabus fast. It's pretty much what I've already told you, but there are a couple of twerps, so it's just always good to go through them. So this all is the standard stuff, the grades I told you about, the quizzes I told you about. You're not allowed to use AI tools or things like that. You know, we do use Lockdown Browser for it. The biggest thing I wanted to talk about is how the exams work, which I said quizzes earlier. I'm using those interchangeably. So basically, how these exams work as far as due dates. So what you'll see in there, it's because I'm a sleep researcher. I don't I don't believe in midnight due dates. So my due dates are set at 9 p.m. because you really should not be doing one of these tests after that. So, like this first one, your first exam is due the 22nd at 9 p.m. Now, I understand things happen, or maybe, you get off work, who knows. So, what I did is I left it where it's open without penalty until the 23rd at 8 a.m. So there's really going to be no sympathy if you miss the 8 a.m. But no, like if you get home and it's 11 and you still need to take it, there's still time, or you could wake up early the next day and take it. So, no, there's some flexibility there for all the exams except for the last two, because these are the ones that this is the last day of finals. So, with it, these will close at 9 p.m. so that I have a chance to actually do your final grade. So know that these actually do close at 9 p.m. on the 10th. On all the other ones, you're going to be able to go until the next day at 8 a.m. But I'd really encourage you to try to do it by the time that they're due, just for your own sanity. And that's really all there is to it. So I'm really looking forward to having you this semester. Please reach out and let me know if you have any questions. And again, just excited to have you. I hope you have a wonderful semester.